Hi guys, we are the group 11 and we're here to discuss widows and widowers, the loss of spouse in the last year. Healing through mindfulness, self-reflection and drumming. Presented by Claire Rada who will discuss about mindfulness, Antoinette Renegado who will discuss self-reflection and drumming by Joni Villaseran.
Widows and the widowers. Widowhood is a marital status that a man or a woman gains once his or her spouse had died. Widows are the women whose spouse had died, while widowers are the men who had lost his wife. Spousal death is one of the most painful and stressful events that could ever happen to someone, especially if it is in the late stage of life. The immediate response to loss is grief, which have a great impact on the individual's mental and physical health. The decline in the bereaved partner's cognitive function leads to the loss of interest in socialization.
So, symptomology. According to Widow Care, most of the individual that has been through grief and death of a loved one reports the following symptoms: fatigue or overwhelming tiredness, aches and pains including head, back, and neck, tightness of the chest, shortness of breath, forgetfulness, inability to focus, appetite changes, digestive issues, weakened immune system, restlessness, and anxiety attacks. There is also called widow brain. A widow brain is described by Trust and Will Blog, a term used to describe the fogginess and disconnection that set after the death of the spouse. It is thought to be a coping mechanism where the brain tries to shield itself from the pain and the significant loss or trauma. Symptoms of widow brain. Some symptoms of widow brain are similar from the mentioned above, but the unique ones are brain fog, extreme sadness, numbness, and nausea. Barriers and impacts to the five health domains. Physical. When widow or widower shows the symptom that the motivation for them to involve leisure is affected, especially when they are feeling tired and fatigued or exhausted. Emotional. Widow or widower that is still suffering from the current loss of spouse has the difficulty to openly communicate thoughts and feelings. It prevents them to be true to themselves and affects emotions and feelings. Social. The tendency of the older adult to involve in leisure caused by social isolation because of lack of interest due to the loss of spouse. Spiritual barrier. Following death or loss of spouse, older adults has issues to reconnect with their spiritual belief, oftentimes affecting their outlook of faith. While last, intellectual barrier. Who has lost a spouse feels overwhelmed and it's hard for them to think thoroughly.
So I'll be discussing about one leisure activity that can be recommended to widow and widowers, which is mindfulness. This is a therapy wherein noticing of what's happening in the present moment, in our body, in our thoughts, and in our environment. In other words, it entails awareness of the present moment. So by focusing on present moments, you will have a better perception of other people's motives, behavior, and even intentions. So there are some benefits of mindfulness to the widows and widower. One is personal growth and positive reinterpretation. In here, there will be an increased positivity, a greater sense of coherence, better quality life, more empathy, more satisfying relationships, and of course, greater hopes. Another benefit is promote spiritual growth. And then it will have also a positive effect on adjustment to bereavement, and then it will create greater capacity to hold and tolerate emotional pain because attachment dictate most of our decisions hence our lives. So by practicing mindfulness, you will be in a position to detach from meaningless attachment and eventually gain control over the pain. Another benefit is reduced stress and anxiety, which is these are the very most common effect of the recreation therapy. Then the next one is have a greater ability to focus and improve sense of well-being. So you will become more positive and start feeling better about himself. And then there are also barriers to participation in mindfulness. So one is daily routine. Many think that this mindfulness activity will hinder their activities in their daily routine. Another one is emotional support. So sometimes you want to give up because there is no support given to you by your family members or your friends. Another barrier is the intensity and frequency of grief related. Sometimes the focus to the activity is divided. Then the last barrier is distress tend to abate with time. So for your information, mindfulness takes a lot of time. So the longer you practice, the easier it gets and the more joyful your life becomes. So there are some recommendation equipments. These are just the common ones, but there's a lot of equipments needed in the mindfulness activity. One is clean mat or caution. Another is guided meditation recording. So this listening track meant to help you calm down and feel at peace in the present moment. Another is the Zen meditation music. It can help your mindfulness practice so you can observe your thoughts and worries will fade away. The other one is incense and candles. So it creates pleasant and relaxing scent. And the last one is the meditation apps. These develop as meditation aids. So the one I have researched as an adaptive or assistive leisure equipment is what they called Muse that can be purchased in Amazon. So it is a unique and wonderful mindful tool. So this is, as you can see in the picture, there's a band here. So that is a wearable brain sensing headband. It measures your brain's activity using EEG sensors. So for example, when you are in more relaxed state, you can hear the sounds of the birds. When your state of higher brain activity, you can hear storm sounds. So you can also choose what environment you'd like to be in. Next is recommendation how to adapt the mindfulness. So it's very important to incorporate the cultural values. You have to also to provide cultural resources because participants are able to gain an understanding of the way that cultural surroundings influence our thinking, acting, and behaving. Another is using culturally familiar terminology. So it's very important to use terminology and visualization that are familiar and relevant to the participants. Then the other one is address religious concern. It's very important not to be left behind of their religious concerns. So there are also risk factors associated with the mindfulness. So one risk is the physical risk. Some participants don't realize the intensity of this form of exercise. Like some exercise, it can be uncomfortable. Other risk is the emotional risk. Unfortunately, very little known about why some people are more vulnerable than other psychological problems brought on by mindfulness practice. Then the last risk is the other people in your life. So it may be challenged to set aside space and time to do the practice. So it's important to request support from your family, friends, and coworkers. So we have also in conducting the mindfulness activity, you have to consider safety concerns that I wrote in the slides, which are the intensity of the exercise, the vulnerability of the person, and the quality of the instruction. Now, when it comes to strategies, we have some strategies to consider in delivering the mindfulness. They have to be self-regulating your attention. So the focus should be in there, orienting yourself towards your experience for the present moment. So focus the present, not on the past. Number 3 is curiosity, because it allows us to begin to turn toward the entirety of experience. Then the next one is openness. So it is one of the 5 core personality dimension that drive behavior. And the last one strategy is the acceptance. It will help you work through each unpleasant experience. So mindfulness is not only for the widow or for the widowers. It can also help treating and preventing relapse in the depressive patients. It can also reduce anxiety and it will treat insomnia. So moving patient, client, participant through all three components of the leisure activity model. Um, so the mindfulness, when it comes to improve functionality, according to the research, it will lower the stress level of the individual, which allows him to be productive and have a positive attitude throughout the day. When it comes to leisure education, educating the individual about the mindfulness will increase his interest in that activity. Just always ensure that instructions are easy to comprehend. And then the last one, which is the recreation participation. So by providing good motivational strategies, the participant will be more likely to fully participate in the mindfulness therapy. So to end in mindfulness activity, I would like to remind that people should select an approach or activity that matches their interests and needs for them to be successful and recover. So that is all about mindfulness.
So the next recreational activity is self-reflection. Self-reflection is like similar with mindfulness, but there are many ways of how to do self-reflection. One is writing a journal. According to Browning G, reflection is a deeper form of learning that gives us the opportunity to preserve or save valuable events that happen to a person. It is more than just remembering, it is honing what really matters. So what are the benefits of self-reflection? Doing self-reflection enables us to pause for a while and taking our time to think about life. It allows to gain perspective. It helps seniors to respond more effective, and it promotes learning and understanding. So what are the barriers to self-reflection? Physical, lack of time, often used as an excuse to do self-reflection, especially when widow or widowers are not used to do journal writing or self-reflection. Emotional, unwillingness to focus on emotions when seniors are still on denial regarding the loss of the spouse. Also, they have a negative sense of impact to self-esteem. Spiritual, lack of motivation to write a journal. Social, fear of lack of support from organizational culture and or from the family, especially when the family does not practices self-reflection or writing a journal. Intellectual, the lack of experience of doing reflection, and sometimes widow or widowers do not see any benefits about it. So what are the equipments for this leisure recreation? So we all know that writing a journal is just like writing a diary. So the equipments for this one, if you have a journal or notebook, you can have your favorite characters placed on it or your diary or anything that is readily available for the seniors. A drawing pen or a pen and colored pens that would make the seniors or the widow or widowers more excited to write on their journal. These materials are readily available from any school supplies or even at a dollar store. Recommendation. When starting a self-reflection, writing a journal, you have to set a regular time to reflect. Minimize distraction to help concentration and being honest with yourself. Know your core values and be forgiving with yourself by not blaming yourself from the loss of the spouse. So what are the risk factors? There are many risk factors for of having of these leisure recreation, but as stated, prolonged or pervasive stress, loss of appetite, continuous of sense of exhaustion. So I will pass to Joni.
Okay, our next topic for the leisure activity when it comes to loss of spouse is drumming. The purpose of drumming is to create sound, music, and movement. When a single beat or tap is repeated, it produces a rhythm. Rhythm and music are but natural to human beings. It flows through our mind, body, and spirit. It allows widows to express feelings of joy and even sadness. Listening to music has been established as a means of maintaining well-being among older adults. Drum therapy is now widely used in different settings to aid in mental health recovery as it brings about positive emotion to older adults. Anyone can participate in drumming. It is either you use a drumstick or just by striking the drum with the palm of your hands to produce vibration and create a music pattern. The use of drumming in the context of drum circles may be useful as a therapeutic tool to promote and maintain or restore engagement in meaningful activities with beneficial outcomes related to physical and mental health. It is through music that one can express feeling without uttering a single word. The rhythm, sound, and music created will be the one that will speak for the person himself. Group drumming is a great opportunity for the older adult to improve their confidence. It can renew their mind and encourage their potential and maintain a healthy lifestyle after spousal loss. The benefits to the well-being of an older adult after spouse loss are first, it creates positive emotion. They will feel happiness and life satisfaction. They will become engaged, active participation and involvement in the activity, relationship with other people because they will feel the sense of belongingness, connectedness, and an atmosphere of cooperation as they perform drumming. It gives them meaning. They will find a new purpose in life after the loss, and they can do self-expression. Also, the last one is accomplishment because they have a control over a skill. And this is the time wherein they will achieve self-actualization. So the other benefits to healing for the widow and the widowers, it promotes relaxation. Participating in drumming reduces stress. It releases negative feelings. The feeling of grief is relieved through self-expression. It puts you in the present moment. As the older adults enjoy the flow of the music, their mind is in the current experience. It allows also an individual to be transformed because it gives them a space to self-reflect, to find their inner peace and mindfulness as they interact with other people who recently had their spouse from death. So the barriers to drumming participation, I was able to identify 5. So first is emotional. The loss of spouse within a year is still in the process of grief. In the social, they are not ready to engage in group activities because they are still thinking of their spouse. Financial, there are changes in the finances of a widow, especially when it comes to decision making, and also there will be a great adjustment in their income. Psychological, they have the tendency to lose interest due to depression after loss. Physical, they may have a weight loss and sleeping disturbance due to grief and depression. So these are some of the recommended drumming equipments. These are just the basics. So the djembe, drum, bongo, congo. So this can be bought in Amazon. So the price range starts from 14 to 39 depending on the price, on the brand. And the lightweight ceramic shaker, you can buy it from Etsy and also in Amazon. The cost is like 41.35 Canadian dollars. Other equipment, they use it in drumming, cardio drumming, the Pro Mic ball, and the basic drumstick. So some of the recommendations and strategies for widows to adapt in drumming. So the facilitator needs to introduce themselves to the participant, and of course, they must be full of enthusiasm and energy. Establishing rapport to client is the key to participation. They must allow the older adults to listen to the produced sounds. Seniors are gently encouraged to join as the facilitator plays the drum. Allow the widows to use drumming as a freedom of expression even without words. And encourage them to go with the flow. Do not control or do not tell them what to do. They are free to create their own music. So the safety concerns when doing drumming exercises. So you must take care of the seniors. They must not hurt themselves. So they have to keep their back straight while they do this drumming. Do not hurt your knuckles and thumb when you're hitting the djembe. Look at the drums while hitting during the initial sessions to prevent injury. And their feet should be flat on the floor. So other diagnoses that can benefit from this leisure involvement are autism and other developmental delays, war veterans and those with post-traumatic stress disorder, substance abuse and addiction, Alzheimer's, mood disorder, eating disorders, patients who have chronic pain, cancer, trauma survivors, emotional issues, depression, anxiety, and anger control issues. So the leisure setting for this kind of activities is in the community center. So the age-friendly community center in Canada was established due to the increasing number of older people who prefers to stay within their homes and community to enjoy aging in place. So the overall goal of these age-friendly communities is to promote and sustain active aging while the elderly maximizes their health, safety, and community participation, thus achieving a healthy well-being. An age-friendly community recognizes that seniors have a wide range of skills and abilities. They understand and meet the age-related needs of the seniors. They respect the decision and lifestyle choices of the seniors, protects those seniors who are vulnerable, especially those who recently lost their spouse. They recognizes the seniors have a lot to offer in the community, recognizes how important it is to include seniors on all areas of community life. So the leisure ability model, the transition from functional intervention until recreation participation. So first, you have to assess the barrier before starting, and it may need one-on-one with the client. So physical, there's no need for you to become a musician to be able to join these drumming exercises. Any level of skill is welcome because you are free to express. So also the equipment is already available in the community. Mental, you have to teach the relaxation techniques. Emotional, encourage expression of feelings for the client to control the beat and the rhythm. And the social functioning, facilitator must establish rapport, encourage, and observe the older adult. So when it comes to leisure education, with the leisure awareness, it makes synchronized beats. Let the rhythm flow as the client enjoys the music and drumming. Social interaction skills, connectedness with other participants, and communication through the use of the music rhythm. Leisure resources, so the availability of equipment is in the community. Leisure activity skills, they may set a regular drumming sessions for the seniors to participate. And in the recreation participation stage, it is when the seniors already exercise their independence, they are free to make decisions and to do what kind of music they want and to enhance the new skills that they have learned. And also, the facilitator may encourage them to start or lead the drumming session. So next will be just a video for us to share about the drumming exercises. So who wouldn't want to join drumming exercises? So that will be our discussion from our group. Thank you very much for listening.
Saglit.